Hello everybody, I'm going to talk this session about how to breathe well and how to look after your lungs. So this session is particularly relevant to everybody at the moment due to the present coronavirus situation, but it's also very important for anybody that has a chest infection or any type of breathing problem. As a physiotherapist, I have worked in chest units in the UK and also abroad. And I want to give you some advice, simple advice, on how to prevent and deal with lung complications and infections. The COVID-19 virus causes various different symptoms: reduced taste and smell sensation, a sore throat, headache, fever, aches and pains, a dry cough, severe shortness of breath, and extreme tiredness. If you develop these symptoms and they get much worse, especially the unexplained shortness of breath, so bad that you can't walk around your house or climb your stairs without puffing and needing a rest, then you do need to contact your doctor and call 111 or call an ambulance. So a little bit about this virus. It attacks your lungs. It causes inflammation and stiffness in your lungs. And the tissue becomes stiff and very difficult to move. So normally your lungs are in your rib cage here. I've put in a blue piece of cloth in there to show you where your lungs sit. And the tissue of your lungs normally stretches so that your lung can expand and then relaxes as you breathe out. Normally, this is nice and simple. You don't really have to work at it at all. It happens automatically. But with this horrible virus, the stiffness of the lung tissue, the inflammation, and the thick glue-like secretions that you start to produce make it very difficult for the air to get in and out. Your breathing feels restricted and tight, and then you start getting short of breath. Your lungs might also feel sore, and then you start to develop a dry cough. This is because your lungs are irritated, and it's your body's way of trying to get rid of whatever it thinks is down in your lungs. If you have a bacterial infection, you generally cough up yellow or green gunge. In pneumonia, you would probably cough up brown gunge and possibly fresh blood. Normally, your lungs have a very clever mechanism to clean themselves, to make you cough up gunge from your lungs. But with the coronavirus, you can get a chest infection on top of the inflammation because the normal secretions are gluey, and when we're breathing in bugs and dust from the air, and the combination of the bugs and dust in the glue that you can't cough up, that can give you a chest infection and make you feel dreadful. So when your lungs are inflamed, you feel ill, you don't move very much, your chest stiffens up, you can't or you don't want to breathe deeply, and you certainly don't drink enough because you're just sitting about feeling terrible. This combination can result in a chest infection developing or a pneumonia, and it becomes very difficult to breathe. And obviously that's when you need to seek help. When you breathe, your rib cage expands out sideways and then it drops in. And most of this work happens at these joints, which is where your ribs join to your spine, and also with your diaphragm muscle. A diaphragm muscle is the floor of your rib cage. When you breathe in, it drops down, and when you breathe out, it comes back up again. So all those things need to be working for you to be able to breathe properly. And in a minute, I'm going to show you some breathing exercises and stretches to move your rib cage to help these joints move freely, to help ease any back pain, keep your chest clear, and make it much easier for you to cope with any chest infections. Okay, so we're going to talk about a little bit of advice to help your lungs in general. So for you to fight infection, you need to have a very good immune system. This is a horrible wee virus, and we need to make sure that we can fight it. So the first thing you need to do is stop smoking, if you smoke, or keep away from anybody that smokes. You need to reduce your alcohol intake, and that's primarily because it inhibits the absorption of vitamins. And if you're not absorbing vitamins, your immune system is not going to be so good. You need to have plenty of rest, try and sleep, but also do moderate exercise so that you are ventilating your lungs. You need to eat well. That means lots of vegetables and fruit, pulses, beans. Even beans on toast is great because you need to keep your gut healthy. A healthy gut is where your immune system comes from and where a healthy mind comes from. There's research to show that a healthy gut does affect your mental abilities, your mental outlook. So to keep your lungs working well, we need to do all the things we've talked about. You need to breathe in lots of fresh air and you need to stop smoking. Moderate exercise is also important because obviously it makes you breathe more deeply, helps you to ventilate your lungs, helps you to cough up any gunk. But this is not a time to start to build up marathon training because if you over-exercise, this is also going to suppress your immune systems. The other thing to do is to take super deep breaths hourly. So that means really deep breaths in, hold and blow all the way out. And do 2 or 3 of them every hour or so at least. The other thing you can do to help if you get secretions building up in your lungs or you've got a frog in your throat, you feel like you're getting a bit chesty, is to keep those secretions really loose. The best way is to drink loads and loads. So you want to drink lots of fluid, particularly hot drinks, because that really does help to loosen the phlegm and the secretions in your lungs. So lots of hot drinks, just even hot water with a bit of lemon in it, lots of that, fruit teas, great. You don't want too much dairy, too much hot chocolate, that sort of thing, because that can make you a little bit phlegmy. You also need to breathe in steam. So if you've got a chest infection, you really need to get rid of it quickly, and the easiest way is to breathe in steam. So if you can get a hold of a big mug or a thermos flask, so something like this is ideal. It's got a small top. And then what you can do is just fill it with boiling water, and the steam that comes out, you can breathe in. So you want to put your mouth over it, open, sit up really tall, open your mouth, and breathe in really deeply. Try and get the air right down the bottom of your rib cage, and then blow out. And then do that again. Deep breath in here, and blow out. So 3 or 4 of those, have a little rest, and then do it again. And you'll find then you'll be able to clear the secretions much more easily. The best way to clear secretions after that is to take a deep breath in and then blow out through an open mouth and do a huff. In the trade, we call it 4-6 breathing technique. So you take a deep breath in, hold it, blow out hard. So that's a really good way of clearing the secretions from low down in your lung. So what I would tend to get folks to do to breathe deep. You breathe in for a count of 4, so you try and breathe the air in here, deep breath in for 4, 1, hold, sniff, you can always get a bit more air in, and then blow out for a count of 6, open mouth, several of those, and then after you've done that, deep breath in for 4 counts, hold, sniff, breathe out for 6 counts, and at the end of it you can huff, and that helps to bring the secretions up from the bottom of your rib cage. Okay, so we're going to now talk about the actual exercises that I want you to do. I'm also going to show you, if you start to get very short of breath and you start to get stressed, a good position to get into, to relax, to calm down so that you can get that overflow into your lungs, to relax your airways, and to breathe more efficiently in a relaxed manner and stop you panicking. So I'll show you that now. So I'm going to show you now a good position if you're starting to panic, if you're not breathing very well and you're starting to get all tense and panicky. This is what you need to try and do. I'm going to do it on the floor with my arms in a chair. You can do it in your lounge, against a sofa or anything like that. Just important that you get your back straight. Or if you don't want to get down on the floor, you can sit on your chair and you can lean on your kitchen table or anything else you can find. Okay, so I'm going to just come into this position here. So I'm going to lean on my elbows, okay, and I'm going to put my head on my arms. You can easily use a pillow if you want to put your head on your hands or on your pillow. But if you're in a bit of a panic, you think, oh, flipping heck, I can't breathe, then this is a good position to get into. So my knees are wide apart, my feet are together, and I'm just going to lean forwards so that my belly hangs down here. You want to be completely relaxed, your belly goes all floppy. Okay, beer belly to the floor. So you're going to lean on your hands, shoulders are down, and now what you're trying to do is ventilate the sides of your rib cage. So the air is going to go in and out here. So in this position, I'm going to take a really deep breath in, but slowly and relaxed, and then sigh out. So you're just breathing in, 2, 3, 4, and sigh. Now, if you're panicking a bit, you won't want to breathe that slowly, so you probably do it much faster. So you probably start with a breathe in, sigh, breathe in, sigh. But as soon as you can, try and slow it down so that you're breathing in again for 4 counts. Breathe in and sigh. And breathe in and sigh. So if you close your eyes and get nice and relaxed, that'll help. Breathe in, 1, 2, 3, 4, and sigh out. So your tummy's all relaxed and floppy, your shoulders are relaxed, and you're in a comfy position. Again, breathing it in, 2, 3, 4, so you're using your rib cage, and then blow out. And then when you feel you've got control over it, then you can start doing the other breathing. So you're breathing in 1, 2, 3, 4, hold it, and then sniff, and then blow out for 6, 5, 4, 3, 2, 1. So you're breathing in through your nose, sighing out through your mouth, and gradually trying to slow it down. Okay, so the other thing I was going to show you, if you're finding it difficult to take deep breaths, it's very easy. I learnt this trick in Norway. We had, I was in charge of a chest unit there, and the nurses developed this system, especially with the older folk, of making them deep breaths, and all they were asked to do was to blow into a bag. And you'd be surprised, when somebody says to you, blow into a bag, you automatically take a deep breath and blow. So you breathe in deep and blow up a bag. So this is from my last loaf of bread, Sainsbury's Best multi-seeded. So you're just taking a deep breath in, blow it into your bag. Now I'm letting the air escape around my mouth, but what you can do is just get a pin, make a hole in it, just one hole. This is a pin from a picture hook, and the air will come out, so you can keep blowing a bit longer. So take a deep breath in and blow out. And as you're blowing the air in, it's coming out, so you don't have to stop blowing, you can keep blowing. So that's a little trick that I learnt about, goodness gracious me, 30 years ago in Norway at least, if not more ago than that. We used to use catheter bags, but any bag will do, it doesn't have to be special, any plastic food bag and a little hole in it to help you blow out. So that's your breathing bag, your pustepose in Norwegian. That's a great thing to help, especially the older folks. If you've got older relatives that are finding difficult breathing, have got secretions in their lungs, pneumonias, anything horrible, asthma, helps to clear their chest. I won't go into any technical details about CPAP and that sort of thing, but it's almost a similar thing to what they use before they put people on ventilators. So it's a great thing for you to have a little go at. Okay, so now we're going to go through some exercises. So these are nice exercises, simple, easy exercises that anybody can do. They're going to be in standing, they're going to be in sitting on the floor, on all fours, various different positions. If you don't want to get down onto all fours, you can do these exercises by leaning on a chair, or the back of a chair. So in that case, I would get you to either come into this position or turn your chair around and lean on the back of your chair and do some breathing exercises and other exercises like thread the needle and so on in this position. Okay, so I'm going to now show you some of these exercises. So I'm going to show you these exercises now. Some of them are a little bit Pilates, but most of them are just to free up your movement in your thoracic spine and your rib cage, so that you can breathe more deeply and clear that chest if you get any problems at all. And some of these are really great to do anyway, especially if you're quite static, if you've been sitting at a desk a lot. So we're going to start off really, really simple. We're going to start with lifting the shoulders and taking them back. Now you're keeping the chest lifted, and then you're taking the shoulders back. So lifting and taking your shoulders back. Lifting and taking them back. So ideally you do this in standing, because your ribs and your lungs can work better when you're standing. So if you're feeling a bit wobbly, stand by a back of a chair or a wall in case you want to put your hand on it. Okay, so now we're just going to swing our arms forwards and back and forwards and back. Now we're going to make it a little bit bigger, so you're getting a big twist in your spine. One arm forwards and one arm back, swing and swing. Doesn't matter too much whether your hips move or not. You're just trying to get lots of nice movement and loosen off that rib cage. Okay, we're going to circle the arm round, one at a time, one, and the other one, up and back. We go up and backwards with most things because it just helps us to open up our chest, stretch the muscles through the front of the chest that can get tight very quickly and easily. And then to add in some more twisting, look behind you as you twist, look behind you as you twist, circle round, look round, circle round, look round. And two arms together if you can, just to get those shoulders and upper backs loose and moving. Okay, now we're going to have the arms forwards and we're going to open the arm and twist and back to the front. Obviously there's a lot of twisting. There's also going to be a lot of stretching up and a lot of bending up and over to the side. So opening and twisting, getting that rib cage moving. You can do this any age, any ability. If you're pregnant, if you just had a baby, if you're osteoporotic, if you're a bit crumbly, anything at all to get those ribs moving, get that chest going, get those lungs working, and getting you a little bit out of breath. Okay, and open and come back to the front. And then just relax. Okay, so we're going to do a corkscrew. So we're going to take the arms up, hands behind the head, shrug your shoulders up and down, reach up and circle your arms again. Circle up, hands behind your head and shrug and down, reach up and lower again. Lift, hands behind your head and shrug and down, reach up and down. Another one of those. And down, get those shoulders working. Not exactly hard work. I'm sure you can all cope with that one. Okay, so now this time we're going to take the arms up above the head and we're going to get a nice stretch. So reaching up and up and up. So you're getting a stretch all down the side of your waist. Probably feel it from your elbows down to your hips, or you should be if you can. Reaching up to the ceiling. Stretch up, stretch up, stretch up, stretch up. Reach up. Can't see my fingers, but I guarantee they're going up towards the ceiling. Okay, now we're going to do a little bit of a side bend. So drop one hand down and stretch up and over. Now we're going up towards the coving. We're not going down towards the floor. Going up and over to the coving. Up to the ceiling. Drop your arm down, reach up and over. So you get a really good stretch down there. And come up. So you're stretching the muscles that go between your ribs. They're really important for your breathing. Nobody talks about them much. But they're your intercostal muscles. They've got 2 layers of those and they're really important. You need to stretch them out so you can breathe, okay? Lots of things going on when you breathe. Deep breath in here and come up. So do a couple of deep breaths in this position now. Up and over, pause, reaching to the coving. Breathe in and out. And come back up. Arm down, up and over. Breathe in and out. You should feel lots of movement going on in the sides of the rib cage there. And we're going to do one more. So get as many of those as you like. Breath in here. Up to the ceiling. And relax. Now you're going to put your hands on your rib cage and do a nice breathing. So hands on your ribs. This is where the breath comes into the very bottom of your ribs. Okay, you can relax your tummy, let it go floppy. You want the air to come in here and in here. We're not doing Pilates just now, we're just breathing. So we're going to take a deep breath in and blow out. You keep your shoulders down, you keep your body nice and upright, and this is where you're going to breathe. If you're shrugging up like that and you find it difficult, you can always put your hands around and cuddle yourself so you can feel your rib cage. I'm going to do this so you can see my ribs move. So you're going to breathe in. Now we did this before, breathing in for 4, holding and breathing out for 6. Okay, so breathing in here through the nose, hold, blow out through your mouth for 6 counts. Breathing in for 4, 1, 2, 3, 4, hold, blow out for 6. And again, breathing in, hold. Now you can get a bit more air, and everybody can do a sniff and blow out for 6. If you feel you're getting something coming up, then just do a huff and clear it out. So another one, deep breath in, hold, sniff and blow out. And another one, deep breath in for 4, 3, 2, 1, hold, sniff and blow out. And so you can do a huff to clear any secretions that should have been lifted up. Okay, I'm going to get down onto the floor now, and we're going to do some stretches lying down and sitting. You might, if you've got stiff hips, you might want a cushion or something to sit on. So I'll show you that now. I've got a little Pilates cushion here. There's a little one like this. If your hips are stiff, then you can just sit on it. So I'm going to pop it down there. I don't need it, but I'll show you what you can do. And then we're going to sit on it. So now we're sitting on the floor, and we're going to do some really nice stretches for your rib cage and to help your breathing. You can, however, if you don't want to get on the floor, you can do most of these sitting in a chair. If you've got stiff hips, you might want a cushion, okay? So if you want a cushion, I'll show you how to do that just now. We're going to get into side sitting. So if you've got stiff hips, so you don't want to sit on the floor, you can put a cushion underneath that hip. You might need a big one, you might need a couple, but that'll take the stress out of your hip. Okay, we're going to get rid of it because I don't need it. I'm going to pop it there. So we're going to sit, side sit like this to start with. We're going to do both sides. So to start with, you're going to have your front leg directly forwards, your back leg is going out to the side, and your front foot is almost touching your back leg. Okay, so we're going to do something called a mermaid in sitting. You can, as I said before, do it in a chair if you don't want to get down onto the floor. So you're going to put your hand on the floor to the side here, and then you're going to lift your arm and lean over towards it. So you're bending your supporting arm, and then you're coming back. Grab your knee and lift up and stretch. So you'll feel a really good stretch all down your side. Lean over and bend the supporting arm, and then come back, grab your knee, lift up and stretch. So you get a stretch all down here. When you first start, it might feel pretty stiff. You might not be able to get over very much, but as you practice, it'll get better. So you're lifting up and stretching, and then you're putting it down, and then you're going over the other way. And then you're coming back, and you're lifting up and stretching over, and then you're putting it down. So now we're going to put the hand on your front knee, and we're going to do some circles. So take the arm up, big circle, up to the ceiling, and bring it round. Again, stretch up, over, and back round. So as you come forwards, you're going to lift the arm, breathing in, and then bring it round and blow out. Again, deep breath in as you come up, and blow out. One more deep breath in. So you can do as many of these as you like. Now you're going to take that hand under your armpit and lift your arm up and stretch up to the ceiling. And then again, take it around and down under your arm and lift up. So breathing in as you come up, and then blowing out as you come down. Look under your armpit and lifting. Take your arm up and down, and then take it down and look under your armpit. Look at under and look up. Breathing in, really expand that rib cage. Deep breath into your chest and coming down. Now we're going to do something else which we often use on a reformer. You're going to start with your hands at the front. So your hands are in front of that knee, and you're just going to bend, drop your head, and then sit up tall and lift the chest. And then drop down, sit up tall and lift your chest. And then drop down, Breathe in. And if you want to have a bit more stretch, you can take your hands around to the side a bit more. And then with that, you bend down and lift up, breathing in. That's quite a strong stretch, so don't force it. And breathing in. And blow out. And breathe in. And then come back into sitting. Excellent. Okay, so now we're going to do the same on the other side. So just swing your legs around. Same thing, front leg directly forwards, back leg directly out to the side, and your foot almost touching that knee. And then put your hand on the floor and lifting. Bend the supporting arm as you lift over, and then grab your knee and lift up and stretch. And then put it down and lift up and over. Supporting arm is bending and lift up and stretch. Breathing in, put it down. Grab your knee, lift up and stretch, breathe in, and down. And one more, lift up and stretch, nice stretch, good stretch all down your side. And now you're going to put your hand on your front knee and circle up and bring it round and lift it up and circle it round and bring it up. Breathing in as you go round. And lifting the arm, breathe in and blow out. Now put your hands on the floor and bend your arms. Drop your head, lift your chest and look up. And drop your head as you come down. Lift your chest and come up and drop down. Lift your head, breathe in. If you want a bit more stretch, bring your hands around to the side a bit more, drop down. And breathe in as you come up. You don't have to do this. Breathing in as you come up and blow and come back up. Okay, so we're going to do some breathing exercises lying on your side. Now this is what we call in the trade postural drainage, and you're ventilating one lung a bit more than the other one. Okay, so when we lie down on our side, you can do this on your bed, so it's great to do first thing in the morning, last thing at night, in between if you're going for a little lie down or a rest in the daytime, especially older folks. And you can also do your blowing out into your plastic bag in this position too. So what you're going to do is just get in a comfy position with your legs bent, and this is the lung you're going to make work the most. Okay, so you're going to breathe in and out, nice deep breaths into this upper lung. So if you watch my lung work, deep breath in and blow out. So you should see my rib cage lifting and lowering. You keep your shoulder down away from your ear and you're trying to ventilate this lung. Both of them are going to work obviously, but this one will be getting more work than the other one. So deep breath in and blow out. And deep breath in and blow out. So just do about 3 or 4, have a little rest, and then do it again. If you do a lot of deep breaths in a row, you're going to start to get a bit lightheaded. So then you can do your breath in, hold, sniff, and blow out. Okay, so breathing in for 4, hold, sniff, and blow out for 6. Air is all the way out. Then breathe in again, deep breath in for 4, hold it, sniff, and blow out. So you can do about 3 or 4 as I said, and then rest and then do it again. While you're in this position, it's a nice exercise to mobilise your rib cage here, your upper back and where your ribs come to your spine. So in this position, put your hand on your forehead, and then you're just going to roll backwards, let your shoulder drop back so you're stretching all around to here, and then you're going to come forwards, put your hands together and then slide your top hand forwards. Obviously if you're on a bed you'll have a cushion under your head. Feel free to use a cushion or a folded towel if you want to do that. So you're rolling forwards, you're stretching the top hand forward, so you're stretching all around the back of your shoulder and your rib cage. Come in, hand on your forehead and twist back. And you can do as many of these as you like. If it feels nice, just keep doing it. Back in, fingers to your forehead and twist. And come forwards. And come back. Well done. Okay, so I'm going to do the same on the other side so that you get a practice to ventilate both lungs really well. So I'm going to just swing around to the other side. And then I'm going to come down onto my side. Okay, so same thing here. Hand on your rib cage so you can feel it moving. Just relax your body, relax your tummy. And you're going to ventilate here. Shoulder down and deep breath in. And blow out. And deep breath in. Hold it. And blow out. So this lung here, the base of this lung is ventilating well. Deep breath in. And blow out. So we're going to breathe in and hold now. So breathe in. 1, 2, 3, 4. Hold. And blow out. All the way out. Deep breath in for 4, 3, 2, 1. Hold. Then you can do your sniff. And blow all the way out. Again, deep breath in for 1, 2. Hold. And then sniff. And then blow out. And if you need to, half. This is very nice for asthmatic patients too. Okay, we're going to do this one, the arm opening. So start here, then put the back of your hand on your forehead. You're just going to roll backwards, stretch that rib cage and upper back all around your waist. Come forwards and stretch that top hand forwards. Come in, hand on your head and twist back. And then come onto your side and stretch forwards. So if you want a pillow, you can just stick anything in there. A folded towel will do. Reach forwards with that top hand. Come in, hand on your forehead and twist back. And again, stretch forwards and reach below. And then breathe in as you come back. Hand on your head and twist. And then one more. Forwards, blow. Hand forwards. And then come back in. Hand on your forehead and twist. And relax. Well done. So we're going to do some exercises on all fours now, which are also lovely for stretching you out and practicing your breathing. So the first one, on all fours, we're going to just stretch the spine to start with. We've done this one in my other classes. So on all fours, you can do a cat stretch. All you're going to do is tuck your tail under and look at your legs, drop your head, and then arch your back and stick your bottom out, look forwards. And then tuck your tail under, grip your tummy and look at your legs. So we're not doing any breathing here. We're just loosening our back and our spine and our rib cage. Tuck under and arch your back and relax. Now we're going to do a thread the needle. I really like this exercise for stretching out backs. So we're going to take one hand and stretch through, touch your head down. We did a form of this when we were on our side sitting position. Reach through and come back up. Reach through and blow and come back up. Now these are all very simple exercises. I'm not doing anything that's majorly advanced. Everything's simple for everybody to have a go at. You can do this exercise standing and leaning on a table or the back of a chair. You don't have to do it on all fours, but of course you get a better stretch if you can do that. So that's thread the needle. Okay, so now we're going to do child's pose. I'm going to turn around so you can see me. So you're going to have your knees way apart. So you're sitting on your heels and you're going to stretch your arms forwards on the floor. So stretch those arms forwards as much as you possibly can and put your head on the ground. So this is what it looks like. You're going to take a really deep breath into the lower rib cage. Deep breath in. And blow out. Now, my clients will know I use this a lot in most of my classes just to make everybody ventilate their lungs well. Deep breathing in and blow out. So you're going to take a deep breath in and then hold your breath. Hold and then sniff and blow out. Again, deep breath in, sniff and blow out. Now you're going to take both hands to one side, okay, and do the same thing here. Put your head on the floor. Deep breath in, sniff sniff, and blow out. So obviously you'll be feeling this lung working harder and stretching more. Deep breath in, blow out. Another one, deep breath in. Try and do 3 breaths in each position. Sniff and blow out. Now come back to the middle. We're going to do the same on the other side. So walk your hands across to the side, head down and breathing in and out. Deep breath. Hold, sniff and blow out. Deep breath in, sniff and blow. Deep breath in, sniff and blow. And bring your hands back in front of you. Okay, we're going to do a little bit of a thread the needle here as well. So keep this hand on the floor and take the other one through and put your head down. So you've got one arm reaching forwards, other one over to the side. Deep breath in and blow. Again, deep breath in, sniff and blow. Deep breath in, sniff and blow. So 3 slow deep breaths in each position, changing sides, head on the floor. One arm forwards, one across to the side. Deep breath in and hold. Sniff, blow out. Deep breath in, sniff, blow out. Last one, deep breath in, sniff, blow out, and then bring both arms to the front. Final breath in, deep breath, sniff, and blow out. Well done. Bring your hands back and come up into sitting. Okay, so we're going to come and stand up now. If you need to hold on to a chair or a sofa or something, then feel free. Otherwise, we're just going to come into a crouch. Okay, and we're just going to stand up from here. Easiest way, I think, is to have your hands down, to straighten your legs, and then to uncurl. So grip your tummy and uncurl like we do in Pilates. You're up nice and tall. And we're just going to take some final deep breaths in this position. So you're going to take a deep breath in, reach up to the ceiling and breath in, hold at the top, stretch your arms up to the ceiling and relax. And again, deep breath in and blow out. Now my favourite stretch, I never fail to do the stretch at the end of a class. Stretch up and over, you probably can't see me very well. Bend your knees and stay there so you're getting a stretch all down here. Deep breath in and out. And then reach up to the ceiling. Same on the other side. Grab your wrist over to the side. Bend your knees and breathe in and out. Stretch up to the ceiling again. And relax. Final breath in. And blow out. Shrug your shoulders. And that's you. Well done. Okay, I know it's quite a lot of hard work. There's a lot of breathing exercises to get your head around. But if you can do all that, it's not going to make you sweat. It's going to help your lungs, keep you breathing and keep you healthy for a long time to come, even when this horrible coronavirus is done and dusted. Okay, keep healthy, keep breathing, keep those lungs good, and see you next time. Bye for now.